Hello and welcome everyone. Today we are discussing about thyroid function tests. TFT commonly refers to quantitation of thyroid stimulating hormone and circulating thyroid hormones in serum to assess the function of thyroid gland to produce and regulate thyroid hormone production. TFTs are used for diagnosis and to monitor treatment of common thyroid gland disorders. The measurement of serum TSH concentration is considered as the most effective single marker for exclusion of primary thyroid dysfunction. Let's learn about thyroid hormone in detail. The thyroid hormone is well known for controlling metabolism, growth, and many other bodily functions. The thyroid gland, anterior pituitary gland, and hypothalamus comprises a self-regulatory circuit called hypothalamic pituitary thyroid axis. Thyrotropin releasing hormone TRH from hypothalamus, thyroid stimulating hormone TSH from anterior pituitary gland, and T4 from thyroid gland work in synchronous harmony to maintain proper feedback mechanisms and homeostasis. The thyroid produces 90% of inactive thyroid hormone, which is called thyroxine T4, and 10% of active thyroid hormone, which is called triiodothyronine, which is T3. Iodine is an essential trace element absorbed in the small intestine. It is an integral part of T3 and T4. Sources of iodine include iodized table salt, seafood, seaweed, and vegetables. Decreased iodine intake can cause iodine deficiency and decrease thyroid hormone synthesis. Iodine deficiency can cause cretinism, goiter, mixed edema, coma, and hypothyroidism. The thyroid gland is responsible for production of 3 iodothyronines. The primary secretory product is inactive thyroxine or T4, a prohormone of triiodothyronine T3. T4 is converted to T3 peripherally by type 1 deiodinase in the tissues with high blood flow such as liver and kidneys. In the brain, T4 is converted to active T3 by type 2 deiodinase produced by glial cells. The third iodothyronine is called reverse T3, which is inactive and forms by type 3 deiodinase activity on T4. Thyroid hormone affects virtually every organ system in the body, including the heart, CNS, autonomic nervous system, bone, GI, and metabolism. Let's learn about hypothalamus pituitary thyroid axis. The TRH secreted by hypothalamus, which positively stimulate pituitary gland to secrete TSH. TSH secreted by pituitary gland, which is positively stimulate thyroid gland to release T3 and T4. If T3 and T4 are produced excessively by thyroid gland, then it will pass a negative feedback mechanism to pituitary gland to hypothalamus to reduce secretion of TRH and TSH. If primary hypothyroidism is suspected, the thyroid gland is not releasing enough thyroid hormones. Therefore, TSH levels will be appropriately elevated and free T4 level will be lower. In primary hyperthyroidism, free T4 levels are abnormally high and TSH level will be low. This table shows levels of TSH, T4 and T3 in different clinical situations. First is primary hypothyroidism, where TSH is elevated and T4 is low. Second is subclinical hypothyroidism, where TSH is elevated but T4 level is normal. Third is central hypothyroidism, where hypothalamus or pituitary disorders are there, which in turn reduces the TSH and T4 both levels. In primary hyperthyroidism, the TSH level will be low but T4, T3 will be high. In subclinical hyperthyroidism, the TSH will be low but T4, T3 will be normal. In central hyperthyroidism, because of another TSH secreting tumor, the TSH will be high and T4 will be high. In pregnant women, thyroid binding globulin production is increased because of estrogen and beta HCG. More free T4 will be bound to thyroid binding globulin, leading to increased production of total T4. TSH levels and free T4 levels will be normal but total T4 will be high. Now let's learn about the sampling details for thyroid function test. The required sample is a serum sample. The collection. Early morning fasting sample is ideal for TFT. And for more accurate interpretation, it is often recommended to perform TFT during the early follicular phase of menstrual cycle, which typically begins on day 2 or 3 and lasts until around day 14. During this phase, the estrogen levels are relatively low and there is less influence from hormonal fluctuations. Let's see some protocols regarding thyroid function tests. Common protocols include initial TSH measurement with thyroid hormone analysis cascaded when TSH is outside the established reference interval. Second protocol can be simultaneous analysis of both TSH and free T4. Indications for free T3 include exclusion of T3 toxicosis, detection of non-thyroidal illness, to adjust levothyroxine doses if TSH remain elevated in presence of high free T4, to start direct thyroid replacement therapy in patients with TSH within reference interval but the persistence of hypothyroid symptoms. Other lab tests such as TSH receptor antibodies or antibodies to thyroid peroxidase can help aid in diagnosing Graves' disease or Hashimoto's thyroiditis respectively. Thyroid autoantibodies are of three types. Two we have already seen, that is thyroid peroxidase antibodies and TSH receptor antibody, and third is antithyroglobulin antibody. As the presence of antithyroglobulin antibody will falsely decrease serum thyroglobulin levels, so thyroglobulin should be measured with antithyroglobulin antibody simultaneously. Thyroid carcinoma related tumor markers include thyroglobulin, calcitonin, and carcinoembryonic antigen (CEA). Calcitonin and CEA can be used to monitor medullary thyroid carcinoma patients' prognosis and treatment outcomes. A growing calcitonin, especially when more than 150 picogram per ml, indicate progression or recurrence. Doubling time of calcitonin is a useful indicator for medullary thyroid carcinoma prognosis. Factors affecting the results of thyroid function test. TFTs can be influenced by medications and illnesses. Any serious illnesses such as heart attack, infection, trauma, serious liver disease or kidney failure. Medications used to treat thyroid disorders. Any other medications including contraceptive pills, steroid hormones, anticonvulsant, anti-inflammatory drugs, lithium and amiodarone, and any mineral or vitamin supplements, particularly if the preparation contains iodine or biotin. This table shows reference ranges for TSH, free T4 and free T3. These are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.